What's up everyone, Dr. Patel here, and in this video we're talking about chin lipo, the entire experience from A to snatched. We have our amazing patient care coordinator here, Marcella.
Hi.
She underwent the procedure how long ago?
10 weeks now, I think.
10 weeks, that's
I think
it?
10 weeks, yeah.
Well, time flies. First of all, I know you see the surgery on a daily basis almost. We do 300 a year and you give people instructions, so it's probably weird being on the other side of it. You got to work all day and then we did your surgery.
Yeah.
But let's take it from when we knew it was time for you to go in. So you took the Valium. I've never taken it. Was that your first time ever taking it?
Yeah, first time.
What did that feel like to you?
Nice.
It definitely kept me like even keeled, like very just going through the motions versus the nerves I had, because I know you guys. So I was like more so nervous about that.
That I was going to pull a prank on you?
Yeah, or something, yeah.
And then we say that like the Valium feels like you had 2 glasses of wine. Like, let's quantify this. Like, was it blackout drunk to a shot of tequila? Like, what would you say?
Excited and I feel relaxed and I'm ready to party.
Or was it not like alcohol at all?
To me, I don't feel like it was alcohol, but from our patients I see sometimes it just has such a different effect on everyone. But obviously to the point of like relaxation, not like anything crazy. It's just relaxed and even.
And then as per usual, we did our markings and our numbing. I use the same numbing I do on everyone, on you obviously, which for doctors out there, we use a mixture of epinephrine, lidocaine, saline, and sodium bicarb injected on a 22 gauge needle, which looks scary as hell. I know obviously you've seen the needle, but what was the needle like first of all?
I thought it was gonna be way worse than it was. It's obviously like pretty long, so you expect something, but I didn't even feel anything. I was making myself more nervous than I needed to be.
And remember, that's from someone who's seen it 100 times, seen people react to it 100 times. The average person is going to be a lot more anxious for the shots than what it is. I can repeat that over and over, but as we're doing it, it's always like shit, I was doing all of this. I didn't sleep for 2 nights and this is all it is. Yeah. It's a much easier process than you can imagine. So obviously then you look like a crazy person, all inflated up like Stay Puft the Marshmallow Man. We went back into surgery. What did the surgery feel like?
I obviously didn't feel anything. If anything, it was more so like pressure, if that. But I feel like I was relaxed. I don't think I even moved on the table. I think I was just very calm.
Well, your eyes are covered. So that part's a little weird because there's some.
At some point, I felt myself like almost wanting to fall asleep, but then I was like trying to obviously keep my neck extended for you. That was my only thing. I just kept telling myself to keep my head back, so that way it made it easy.
As I do for every patient, we put in all effort. And your man came to pick you up. Is that right? You went home.
Yeah.
So the first question I get to ask you, because I don't get to ask people, is you have 2 twins. Cutest guys in the world. Were they 3 years old now?
Yeah, 3. Yeah.
What was their reaction? I always wondered, like people, we do this on so many moms, right? It's a mommy makeover type thing. What was their reaction? What was it like taking care of them?
I feel like they knew that I was like they were really tender with me. Obviously with boy moms know they can be pretty rough, but they knew something was different. So they were a little bit more reserved with me. It was hard for me to not pick them up, but I know it's very important to obviously not move your neck. So that was the biggest thing. And then by week 2, they wanted to wear my head wrap because they thought it was like a toy or something. But I mean, it was great. It was a lot easier than I thought. I thought I was going to be more worried about it, but I just did what I had to do.
So you couldn't pick them up. Obviously, it's like I always remind patients who are moms, you can't pick them up, and putting them to sleep and stuff is hard. So how did you manage all that stuff?
I was that whole first 2 weeks. I was if I was helping my partner out with them, I was definitely bending at the knees versus bending down with my neck, just to make sure that I was restricting movement as best as possible. That was the biggest thing.
And I knew you'd be a good patient, so I wasn't worried. But obviously, I worry that people, are going to be in a situation where you don't have a choice to pick up a crying child, so don't put yourself in that situation. But you'd follow the results, and your man takes good care of you and the kids, and helps out a lot. So the key is to have a support system in that situation, even though it's easy and not painful. It's honestly worse because you're like, your body doesn't tell you don't do that. It's only you see my face annoying you if you did it. That you're gonna do that, right? Awesome. So any last tips or tricks for parents just on how to get through that and what was hard, what was easy, things that helped?
I think having a schedule, like things planned out for how you can help your partner with that. Because obviously sometimes moms, I feel like, take control over running everything and what to do and what not to do. So kind of having that conversation ahead of time is a big thing, and planning out activities for them that way you can stay at home and rest and stay elevated. That's the biggest thing.
Okay. The head wrap. Was that the worst part of surgery? Or was
No.
it
Sleeping elevated.
Okay.
Yeah, head wrap was fine. I was used to it after day 4, day 5.
She came to work wearing.
Yeah.
Obviously, this setting's a little bit easier. Everyone usually has it done.
Yeah.
And then as you're going through recovery, I know the first couple days, like pain, like swelling, bruising. Tell me.
No, I stayed ahead of the pain with my meds. I don't even think I took them past day 3. If it was randomly to help me sleep elevated. Just like completely stay in that, and stay in that position.
Sleeping pills.
Yeah. Massages I was on top of. I started day 5.
You did 3 types of massages, right?
Yeah.
You did 2 with 2 different professionals,
and then
you did your own. So let's start with your first massage was yourself, right?
Yeah, that was myself.
So what was that like?
I thought I was going to be a little bit more restrained because myself, but I just obviously wanted to obtain optimal results. So I really went in with my self-massaging. I watched the video. Obviously, I know how he goes through it with patients as well, too. I had tools necessary. I had a gua sha. I had some gel. I had arnica gel to help really get in there and self-massage because, like I said, I wanted optimal results, of course.
And we can thank Marcella for this. If you check out the link right here, it's linked to our Amazon store that has what I would call Marcella's favorite finds from having gone through this process, and all the tools for massage to different things that are helpful. Check out that link. You're going to see things that you're going to find very helpful. So you went through the massages, obviously not much pain. Did you have any bruising?
Minimal. It was mostly sides, if anything, but that went away fairly quickly.
Okay. And then last but not least, so did you have any speed bumps along the road? Any tough areas?
I think just sleeping elevated because I don't sleep elevated. So having pillows, which obviously are in the link because they're a major key for me. I sleep on my stomach, which is really bad, but having that tool with me helped me a lot and just helped me achieve optimal results, of course.
Okay. And I know, just to be clear, you didn't have any previous Kybella or anything like that. So generally when people are younger, have a great bone structure, haven't had Kybella, cool sculpting threads in their neck, previous work done, we anticipate most people's recoveries to go smoothly. It's a little bit of a roller coaster because day to day, you're like, oh, shoot, it's worse today than it was yesterday, right? And so it takes a little bit of patience. Now, being honest, like she's seen the end result so many times that she wasn't worried she's going to get there. And I feel for people who are like, oh my God, am I that one person who didn't, or that wasn't going to happen. So today we're 10 weeks out. We looked at your before and afters, right? How does this change make you feel?
A lot more confident. This under area bothered me a lot, especially side view. So now I'm great from all angles.
All right. Well, thank you for helping so many people out. I'm glad you had a smooth, easy recovery. And hopefully that's in the books for all of you guys. Don't forget to like this video, subscribe to this channel for more awesome content, and leave a comment below telling us what videos you want to see in the future.
Okay.